how bad really are antipsychotic medications. In this video, we're going to talk about how bad really are the antipsychotic medications. We're going to explore it. I'm going to give you my official stance on what I think of antipsychotic medications, because if you've looked at some of my other videos, I have one that says that they're very dangerous, and then towards the end of that video, I think I say that I'm glad we have them. And so I'm just going to kind of clarify what my personal position is on antipsychotic medication, if you're curious. And if you haven't watched any of my videos, I'm a psychiatric nurse. I've worked in state hospitals, outpatient, inpatient, stuff like that, and mental health. And we're just going to kind of explore it, and we're going to talk about antipsychotic medication. And I really think that there are no drugs, and I really mean no drugs, that you can categorically say are 100% bad, that should never, ever, ever, in any situation, ever be given to anybody. That's my true position. I feel like every medicine, every drug, the worst street drug out there, probably to some degree, has some sort of benefit for someone. And I think maybe cigarettes would be a good example to start with. Cigarettes, we know, are bad for our health. They're horrible for our lungs. A high percentage of people get lung cancer if they smoke cigarettes for a long period of time. And yet people still do it. And yet cigarette smoking could still be considered good, at least from my perspective, for someone if the benefits outweigh the risks. And I know some people might be like, that's just a rationalization. There's some people who might say that just categorically cigarette smoking should never, ever be done. It's always bad. And although I hate cigarette smoke, I can't stand the way it just irritates the living hell out of me. I still think that for some people, that might be a good choice for them because the benefits outweigh the risks. And I think it's like that with every medication out there. However, with antipsychotics, I feel like their risk is so disproportionately large compared to so many other medications on the market that they should be rarely used, and that they're often used way more than they should be, and that we as a society and as a culture have relied on them more than we really need to. So that's kind of my official stance. I am glad that we have them. Trust me, I'm glad that we have them. There's just some unfortunate circumstances that I've been involved with while working inpatient where I'm like, man, if we didn't have this medication, what legitimately would we do? How would we keep ourselves safe? And how will we keep other patients safe? And how will we keep the patient who's actually receiving the medication safe? That is because their mental diagnosis or whatever that they have, their condition, their mental condition is so severe that I feel like they need something to help them. So that's kind of my official position on antipsychotics. I don't really like them. Like if I had to take an antipsychotic medication, which eventually I'm going to do a video where I take 5 milligrams of olanzapine, also known as Zyprexa, if I had to take it on a routine basis, I would be exceptionally fearful. And I don't know, after knowing what I know about the medications, I would be terrified. And if you read the package inserts, which is always a great place to start with a medication, and you look through some of the side effect profiles of these antipsychotic medications, it's like reading a Bible full of side effects. And I encourage you to do it. You know, if you're taking these meds, go through and read the side effects and Google some of the weird, bizarre names that people come up with some of the side effects. Sometimes you're going through and you're like, what the hell is that? So you Google it and you're like, oh, okay. And you just wonder how they came about, some of those names. It reminds me of going through school. And, you know, like when you're taking a science class, like biology, like the Krebs cycle, right? Anybody heard of the Krebs cycle? Something with the cells. And I think it's like how a cell generates energy or something like that. But it's like, why the hell did you name it the Krebs cycle? Why'd you have to do that? I'm the guy that, it's like if I discovered something and I'm like, we're going to call this the Nick cycle. It's like, okay, can you get any more pompous? Like, we're appreciative of the work you did, but could you just name it something that makes sense, for crying out loud? I'm going off on a tangent. I thought I wasn't going to, but I did. But so with these antipsychotic meds, another thing to keep in mind is historically they've gone through so many different name changes. And antipsychotic, when I hear it, just like antidepressant, but more so with antidepressant, but I'm not going to go off on a tangent, but it's like they're not really anti. Like when you take something anti, it is like against that. Like an antibiotic is against bacteria. It is going to kill the bacteria. An antipsychotic does not kill the psychosis, probably because there may not be any sort of organic process for that psychosis that makes sense. There's not any sort of thing that can be killed to kill the psychosis. That could be a possible explanation, right? And so when I think to the nomenclature, the naming that is surrounding these meds, it's really frustrating to hear about antipsychotics. And when you learn about the history that before they were known, and known is not a great word, before they were marketed as antipsychotics, they were known as neuroleptics, which is better. That means like something that depresses the nervous system. I feel like that is more true to its true character to some degree. And then before that, they were known as major tranquilizers. Like that was in the 50s when they were first discovered. And then even before that, though, I think there was another name that starts with an A. Leave a comment if you know what that name is. I think it starts with an A. There was another name they were known before major tranquilizers. But if you look at like all the different namings of the antipsychotic medications, like that in and of itself should make you a little skeptical of the efficacy of antipsychotic medication. The fact that it had to be labeled antipsychotic medication. And I'm not saying that there's medicine out there that maybe we didn't know what it was used for, and then after some trial and error, we eventually found a purpose for it, and then it got the name like anti-something. Like certainly that's been the case in certain medicines. But with antipsychotics, it's just not that clear and cut. You can't measure psychosis in a purely objective, biological way where there's no subjectivity whatsoever to that measurement, and then give somebody an antipsychotic. And my furnace just started. I'm going to go shut it off so there's not a background noise. All right, the furnace shut off, so no, there's no more hissing. So what I was trying to say is that it's very, I can't remember where I was at, but something about, like trying to objectively measure psychosis like you would say a microbe, like a bacterium, and then you give somebody an antipsychotic, and then you remeasure to see did their psychosis decrease. There's no such thing as that. We have all these subjective scales for measuring psychosis that, okay, I'm not saying they're horrible and they have decent reliability when it comes to like, if I were to use the scale and measure someone's psychosis and you were to use the scale and measure someone's psychosis, and that's like the worst, scale is probably the worst way to phrase it, because it's not like we're just looking at them and seeing kind of what symptoms are they displaying. Are they talking out loud frequently? Are they agitated? There's all these things that some of these scales measure. But like, and they have decent reliability in the sense that you and I could both do it. And say we had to give someone's psychosis a score from like 0 to 10, 0 being no psychosis, 10 being very acute psychosis, we're probably going to come around the same number. Like I might rate it a 7, you might rate it like a 6 or an 8 or something like that. So they're decently reliable in that respect, but that doesn't mean that they're objective. It's like, oh, because we all agree the fact that 2 + 2 is 5 means that, like, it doesn't mean that the scale that we're using is objective whatsoever. And I'm not trying to just completely disregard our subjective interpretation of someone else's psychosis, because that would be silly. Like if you work inpatient, you can tell if someone's acutely psychotic, you can tell. It's pretty obvious. So I'm not saying that like it's just pointless. There's no measurements whatsoever. My point here is that it's just so difficult to know with any sort of absolute certainty what these meds exactly do, especially because they don't just work mechanically like, say, an antibiotic does. So it's so difficult to tell what they really do. And I am by no means an expert. I'm only a nurse who reads a lot about psychotropic medication. And I even feel like few psychiatrists I would consider as like true experts. I feel like you have to have a very strong background in biology, a very strong background in organic chemistry, a very strong background in psychiatry, and then you have to have published quite a bit of research to be any sort of expert. So there are very few experts when it comes to psychiatric medication and what they're really doing. And even if you look at the history of when these meds first came out, like Thorazine, the way that they would describe how it interacted with a psychotic patient versus the way that someone might describe how Thorazine interacts or chlorpromazine interacts with someone today, you're going to get two different descriptions. And a lot of times the differences in those descriptions can be kind of historically accounted for, because in the 1950s, when they didn't feel like this medication had any sort of antipsychotic effect, they wouldn't attribute it to helping necessarily with their psychosis. They would just be like, well, it tranquilized the person. But because we've been so indoctrinated with antipsychotics and them having effect on psychosis, we're more likely to attribute their power, their effect on psychosis, to that antipsychotic effect to some degree, if that makes sense. I feel like I'm just talking nonsensically right now. But so there's absolutely a lot to be considered with antipsychotic medication. And I hate to make it like anything polemic, because I sometimes feel like that's what it's gotten into. It's like you're either for or you're completely against psychotropic medication, and then that's it. And then it's just these two sides going head to head and like calling each other's names and doing all sorts of that stuff. And I think that's ridiculous. Like, I think the reality is, minus the small percentage or maybe somewhat moderate percentage of people who work in mental health that are psychopaths, and that goes for some psychiatrists out there as well. But I think the reality is, like, so many of us who work in mental health or who have mental illness or conditions or whatever, so many of us just want something that works. Like, we just want something that works and doesn't have this huge list of side effects. And if we truly had an antipsychotic medication that didn't have so many horrid side effects, I would be like in love with it. I'd be like, thank God we have this medication. I'd be jumping on the bandwagon and it would be amazing, but we don't. And it's silly for us, though, to just sit here, I think, and like butt heads. And it's funny because I've watched a lot of debate between psychiatrists and between mental health professionals about the efficacy and helpfulness and effectiveness and all of that of all these medications. And sometimes I'm like, my God, the accusations that can come from kind of the anti-psychiatry movement are like very strong accusations. And sometimes they're well-founded accusations. I mean, when you look at the history of some of the things that we have done to people with mental illness, it's like, bro, it's pretty damn barbaric. But then there's also a lot of just well-natured people out there that still prescribe lots of antipsychotic medication who aren't barbaric. They're not evil people. They're good, legitimately good-natured people. So I think it's definitely a huge disservice for us to try to sit there and like beat heads with these people. And I don't like, where do I lie? Like, if this is anti-psychiatry and this is like pro-psychiatry, I'm probably like, I don't know, like way over here. I'm not as far as, say, Peter Bregan, who is just completely opposed to all psychotropic medication. I'm not, I don't think I'll ever be there. I'd have to have like exceptionally strong data to support that stance. And then even then, like in the case of cigarettes, I can't say that people shouldn't take cigarettes. Like, even though I hate cigarettes, I couldn't say, because I do think for some people there are some benefits. And it's like, even with antipsychotics, if it's absolutely true that they do cause brain damage, that they cause all these horrible side effects, is it still possible that there is some benefit to them? I think that's the big question that the anti-psychiatry movement needs to answer. Is it possible that there's still benefit from them? Like, if I go out, and I guarantee alcohol does not help me physiologically, but like if I go out and say that I get a little tipsy and I'm more social and I love myself when I'm drunk, like it's very fun, I'm very affable, I'm talking to a lot of people, I'm very social, I'm like a butterfly. Like, not that I get drunk a whole lot, and I don't even get drunk. It's more like 1 or 2 beers and I get that nice buzz, right? But like, if that happens, is that bad for me? Peter Bregan would say it's bad. He'd say it's bad, right? He'd be like, you shouldn't do that. But I'm like, well, I went out and I had a really good time. I enjoyed myself. My liver's going to regenerate itself. I do it maybe once every few months. Is it really that bad? Like, I had a heightened social experience. I really enjoyed the experience. I met some friends. Like, we had to, like, really, do you really think that the risk there outweighed the benefit? I don't know. To me, that is crazy. Like, you have to be able to look at things situationally and within that kind of context. And I'd love to ask Bregan, like, and don't get me wrong, I love Bregan. I think that guy is a freaking godsend. The dude is incredible, and his bedside manner, I think, is just, you can tell he's a genuinely empathetic person who cares about people. And if you watch a lot of other psychiatrists, which I've watched them interact with patients when I worked at the state hospital, I cannot say the same for them, unfortunately. And so for me, like, Peter Bregan's heart is just gigantic. Like, his heart is like, my God, bro, like that in and of itself is amazing. And if there's anything that I exalt him for, it is for his heart and his empathy. But that's the question I'd like to ask Bregan. Like, what about, like, how do you really, how would you view something like that? Like someone who goes out and has a little alcohol here and there. And even Bregan, like, if you listen to him, he talks about one time when he went through caffeine withdrawal and he was addicted to caffeine. And that's what I think is kind of ironic. It's like, well, Dr. Bregan, you know, you were doing caffeine. Caffeine is a drug. It's a legitimate drug. It is a legitimate drug. And there are people who go, like, caffeine withdrawal can be a serious thing. People go through all sorts of crazy, they can have panic attacks, they can have heart palpitations from it. Like, crazy stuff can happen from going through caffeine withdrawal. So I just wonder, like, how does he put his caffeine experience, How does he reconcile that experience with his stance on antipsychotic medications? I would love to ask him that question. If anyone out there is close to breaking, please shoot him that. I'd be curious. And so that's why I'm not like 100% opposed to antipsychotic medication, because I always feel like there is some sort of situation out there where it can be beneficial. And for those of you out there who are watching, because I do feel like, and I'm very appreciative of these viewers, by the way, for those of you out there who are 100% anti-psychiatry, I love that you're watching this, and I love that you're sticking with me, and I love that you're watching my channel. But I would be curious how you answer that question. Like the small percentage of times when an antipsychotic may be appropriate for someone or does seem to show some sort of benefit, how do you rationalize just saying like, no one ever should ever have antipsychotic medication? I'd be curious to see how you answer that question and what your answer is to that question. And it's very easy for us, especially when I was younger. Like I noticed when I was younger, it was very easy for me to kind of pigeonhole myself into a certain position while not understanding that there could be a context such that a position opposite of mine actually might make sense. And so that's why I really try to take things on a contextual basis. And I feel like that needs to be done with medication, with mental illness, with the healthcare that we're providing to our patients and things like that. There's something else that I want to add here too, is that antipsychotics and psychotropic medication has a unique place in our healthcare because it's given to people involuntarily. So let's pretend though that let's pretend that antipsychotic medication had no harmful effects except for the fact that it sedated people, but it otherwise really helped treat people's psychosis. If that was the case for antipsychotics, I think they'd have a much better place and much better reputation in society, in our culture, and in medicine. But if all of a sudden that same antipsychotic medication was given to people involuntarily, I think all of a sudden that would damage and tarnish its reputation. And the same could be said for any sort of medication that has been proven objectively useful. And I'm just going to use antibiotics because I feel like they're the easiest one, because you can measure the amount of bacteria in someone, then give them the antibiotic, and then you can see that the amount of bacteria has decreased. But let's say that people could be put involuntarily on antibiotics, and the same amount of people that were put on involuntary antibiotics as were psychotropic medications. I think that you would see that the reputation of antibiotics would be tarnished, and then all of a sudden you'd get these people who might just be completely against antibiotics all the time. And I think to some degree, the fact that psychotropic medication can be prescribed to someone against their will has absolutely tarnished the efficacy of some of the medication. And I'm not saying the medication is like super efficacious by any means. Like antidepressants, I'm like, those are just, I'm not convinced whatsoever. But I'm just saying with antipsychotics, I have seen instances where they absolutely have taken someone out of their psychosis. They've helped them with their delusions and all of that. But because there's that involuntary aspect to it, I think in some people's mind, especially some people who've received the medication when they didn't want it, I think to them, it's just like, it made me feel yucky. It made me feel icky. It did all these things to my body and I hate it. And so I completely understand how that could happen. And I think to some degree, the benefit of antipsychotics, whatever that may be, has been irreversibly tarnished by the fact that that medication has been given to people involuntarily. And I'm just mentioning this for kind of food for thought. Like, would we have such a negative view of antipsychotics if they weren't given to people involuntarily? I don't know. Probably not, right? Like, it wouldn't make sense for us, because then it would just be like, well, it's a medication that's out there that if we find it useful, we can use it, but it's up to the individual. Like, I don't think we would think it's as bad as a medication as a lot of us do if that were the case. At the same time, it's also just mental conditions and mental illness is just a weird thing, because some people, when they're truly afflicted by an illness, like that is the part of your body that's supposed to help you make rational decisions, and now you don't have it. So it puts us in a very weird position. Anyhow, I wanted to make this video about giving kind of my official stance on antipsychotics. I wanted to give us kind of some food for thought, just to think about antipsychotics from a very holistic and historical perspective. And hopefully at the end of this video, you have thought to yourself, like, maybe you've challenged some of your opinions you've had about antipsychotics, maybe challenge some of your negative opinions, maybe challenge some of your positive opinions. And that was the purpose. I don't know if I actually fulfilled the purpose of this video. I'll probably know after I read some of your comments. So, all right, hopefully you enjoyed this video, and I'll see you on the next recording. Bye.